So now we are going to discuss about the adrenergic drugs. Now, what are adrenergic drugs? Catecholamines and non-catecholamines, these two group of the drugs are called as adrenergic drugs, and they are included within this group with their specific characteristics. What are catecholamines? Catecholamines basically are sympathomimetic drugs, and they contain a catechol ring in their structure. This is the ring structure to which attached are two hydroxyl ions. So that's why we call them catechol. So that's ring structure gives them a specific characteristics. Now here is the nerve terminal. This is actually a schematic diagram of a generalized noradrenergic junction. Tyrosine is transported within this here, the tyrosine, it is transported into the noradrenergic nerve endings or varicosity by a sodium dependent carrier. This is a sodium dependent carrier A. This helps in the transmission of tyrosine within the nerve terminal. Tyrosine is converted to dopamine and transported into the vesicle by the vesicular monoamine transporter. We call it VMAT. By the help of this, it is transported within the vesicle, and this can be blocked by reserpine. This VMAT can be blocked by reserpine. The same carrier transports norepinephrine. This is the same carrier, and it can transport norepinephrine and several other amines into these granules. So now here, this is the granule, and within this granule, several other neurotransmitters, they can be transported by the help of VMAT, and this in further can be, this reserpine can block the transport of these, and by blocking VMAT. Dopamine is converted to noradrenaline. Now here the dopamine is converted to noradrenaline in the vesicle by dopamine beta hydroxylase. So dopamine beta hydroxylases are certain enzymes that convert dopamine into noradrenaline. Physiologic release of transmitter occurs when an action potential opens the voltage-gated calcium channels. Now here, these voltage-gated calcium channels, whenever they open, this calcium intervenes and it comes inside and it helps in the further release of noradrenaline within the nerve synaptic clefts. Function of vesicle with the surface membrane results in expulsion of norepinephrine, other co-transmitters, and dopamine beta hydroxylases. Now, the release over here can be blocked by several drugs like cocaine, tricyclic antidepressants. They can block the release. Ritilium, gonethidine, they can block the release. Moreover, cocaine and tricyclic antidepressants even, they can inhibit the reuptake within the nerve terminals. So the conclusion or the summary is that noradrenaline, it is released at adrenoreceptors and also other receptors it can act, and this is the postsynaptic cell where its actions, they are initiated. Now this is a schematic diagram showing the release of catecholamines and the biosynthesis. This is tyrosine converted to dopamine, noradrenaline, and adrenaline, as shown within this previous diagram. Now this table, it shows the receptors alpha-1, alpha-2, beta-1, beta-2, beta-3, D1, and D2. Now here, the tissues where they are located, the list of the tissues where they are located as we discussed previously. And these are the actions, whatever they initiate on stimulation or inhibitory effects. Now this is the signaling mechanism. This signaling mechanism shows the agonist binding to the receptor, and then it shows the stimulation of alpha-1 receptor. These through the GQ pathway. Here the units beta and gamma, they are separated and they are further stimulated by GQ pathway. In here what happens, GTP is converted to GTP. It further enhances and initiates a chain of reaction by stimulating phospholipase C. This phospholipase C, it goes further through divided into two pathways. This is the inositol system, IP4, IP5, IP2, and IP3, and diacylglycerol. Diacylglycerol, it stimulates and activates protein kinase C, and this is the activated form. However, phosphoinositol systems, IP3s mainly, are liberated. They further act on the stored calcium and make it free. And this free calcium, it has got an effect on the protein kinases that are already calcium dependent, and so the activated protein kinases are formed and the biological effect is produced. Now, this signaling mechanism is for the beta receptors, where the GS pathway is stimulatory pathway. GTP is converted into GTP, and here GTP, whenever this subunit, it further stimulates adenyl cyclase enzyme. It is different from the previous one, where phospholipase C was stimulated, and here adenyl cyclase, it is stimulated and it is converted into activated form of cyclic AMP is formed by conversion of ATP into CAP. Now here, the other pathway is GI pathway. This is inhibitory mainly, and it can inhibit this enzyme adenyl cyclase, so it will restrict the formation of ATP and conversion of ATP into cyclic AMP. Now, if cyclic AMP is formed, it has got a positive effect on protein kinases. These are the protein kinases R2 and C2. They are further liberated into and subdivided into two C forms. What they do, they initiate enzymatic reaction in which there is phosphorylation. A phosphate group is attached to the enzyme, and so biological effect is produced. ATP is converted into ATP. Now, here is the classification. We classify adrenergic drugs into chemical classification. Natural are adrenaline, noradrenaline, dopamine. Synthetic, isoprenaline, dobutamine, rimitirole, isothane, and hexoprenaline. Non-catecholamines, they are, as we discussed earlier, that they have got a non-catechol ring. They don't comprise of catechol ring in their structure. And the drugs included in this class, they are ephedrine, pseudoephedrine, amphetamine, dexamphetamine, terbutaline, metreminol, salbutamol, phenylephrine, oxymetazoline, and xylometazoline. Now, the classification that is based on receptor selectivity, mainly alpha receptor agonist. Alpha 1 agonist, we have alpha 2, and then we have combined alpha 1 and alpha 2 agonist. Beta receptors, mainly beta 1 selective agonists. We have similarly selective beta 2 agonists, and then we have selective beta 1 and beta 2. So these drugs, they are selective only for specific receptors. However, some drugs, they have got selectivity for both the receptors in higher doses. However, in some of the cases, some drugs, they lose their selectivity, and in higher doses, they can become non-selective. Alpha and beta agonists include adrenaline or cyprenaline, and adrenergic dopaminergic agonists include dopamine. Classification according to mechanism of action. Now, some of these drugs, they are directly acting sympathomimetic drugs, that they directly combine with the receptors and then initiate chain of actions and biological effects are produced. However, some of them, they are indirectly acting sympathomimetic drugs, and they act indirectly through release of noradrenaline. Some of them have got mixed actions, that they can act both directly and indirectly, like ephedrine and metreminol. Non-catecholamines, they are having receptor selectivity, and according to receptor selectivity, we can call them alpha non-selective, that is, they act on both alpha 1 and alpha 2. Beta non-selective means they can act on both beta 1 and beta 2. Beta 1 selective means they only act on beta 1 receptors. Beta 2 selective, they only act on beta 2 receptors. Alpha and beta both means they can act on both alpha and beta receptors, like alpha 1, alpha 2, beta 1, beta 2, and sometimes beta 3. Characteristics of catecholamines. Catecholamines contain catechol ring in their structure, which is known as 3,4-dihydroxybenzene ring, because these two OH ions are attached at the position 3 and 4. They are inactivated by enzymes COMT and MAO, like catechol or methyltransferase and monoamine oxidases. They have got short duration of action. They're not effective orally. They're given parenterally or by inhalation, but never given through IV route. Non-catecholamines, they cannot cross the blood-brain barriers. Small quantity is excreted unchanged in urine. They are directly acting, supplied by postganglionic sympathetic nerve endings, and effective even when sympathetic nerve endings have been cut or are inhibited. Most important general properties of non-catecholamines: they are very much effective orally, they have got longer duration of action, they do not contain a catechol ring in their structure, that is dihydroxybenzene ring, and they are resistant to inactivating enzymes of liver and other tissues like COMT and MAO. Important general properties of non-catecholamines: they're given in larger doses, they can cross the blood-brain barriers and are powerful CNS stimulants, and substantial fraction means a very small amount is excreted unchanged in urine. Not all are directly acting, some are indirectly acting, however, some are mixed as well. Thank you for your attention.